Good morning, Professor and classmates. Today, my esteemed group and I are going to present the following important topics: effective communication strategies, comprehensive palliative care, various heart diseases and their management, the complexities of psychiatry, the intricacies of diabetes, and the challenges of cancer treatment. I hope you enjoy it.
Hello, everybody. Today I'm going to talk about communication in nursing, especially how we communicate with patients, their families, and other healthcare staff. Communication is one of the most important skills in nursing because it helps us give better care and build trust with our patients. Good communication means not only speaking but also listening carefully. When we listen to our patients, we can understand their fears, pain, and needs. Many patients feel nervous or scared when they are sick or in the hospital. So, our words and tone can make a really big difference. A simple smile or a kind word can make patients feel safe and respected. We also need to use clear and simple language. Some patients do not understand medical terms, so we must explain in words they can easily understand. For example, instead of saying hypertension, we can say high blood pressure. This helps them follow instructions and take care of themselves better at home. Communication with families is also very important. Families often feel worried or confused about their patient's condition. As nurses, we must give information with empathy and patience. We should let them ask questions and make sure they understand what is happening. Good family communication builds trust and reduces anxiety. Communication is not only with patients and family, but also with the healthcare team, doctors, other nurses, and assistants. When we share information clearly, we avoid mistakes and improve patient safety. Teamwork and respect between staff are essential for a good hospital environment. In conclusion, communication is the heart of nursing. A nurse who communicates well shows compassion, understanding, and professional. When we speak with kindness, listen carefully, and share information clearly, we help patients heal not only in their body but also in their mind.
I'm going to tell to you about palliative care. Palliative care is a specialist medical care of people living with a serious illness. This type of care is focused on providing relief from the symptoms and stress of the illness. The goal is to improve quality of life for both the patient and the family. The main, the main goal is to reduce suffering and enhance overall well-being by addressing physical, emotional, social, and spiritual needs. Palliative care is appropriate for any age and at an stage in a serious illness. It can be provide almost curative treatment. Unlike hospice care, which is especially for the final weeks or months of life when curative treatment as short palliative care and being of sounds a serious illness is diagnosed. Care is provided by specially trained teams of doctors, nurses, social workers, and families who work together with the patients, others, doctors to provide an extra layer of support. Key benefits of palliative care: enhances symptoms management, improved quality of life, better communication and decisions, and compromise family support. Palliative care offer an extra layer of support to help patients and their family cope with serious illness and its symptoms, while the patient continues to pursue curative treatment if they choose to do so.
My name is Carol Montesum. West will talk about ear disease. Ear disease. Ear disease refers to a condition that offers to earth's structures and function this mode and this coronary artery disease we also with to slow it visit and place to earth's become other time includes in arrhythmia air to failure a problem and constitutes earth's defects. Arthritis is one of those ladies caused to arthritis in Wellesley y often the those 40 in this artery high blood pressure and smoking for diets to lock exercise or genetic factory symptoms or very dependent on the type of reactive disease both included. Um, Prevention and treatment involve ladies and like acting artists con diet regular, physical activity and condition and night to lose pressure and diabetes, in some into medication, physical and procediment stood and surgery and mindfulness which is important to prevention disease. Prevention disease is crucial because it one allows to ladies causes in this where how many ERT condition all time healthy habit by the time symptom happen resist to dremai I already or prevention or life habit to improve overall qualities of life is health complication to archie and air factory and artist net fair suggest.
My name is Rachel Cortez. Definition of psychiatry. Psychiatry is a branch of medicine dedicated to the study, diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders. Its main goal is to help individuals maintain a healthy balance between mind, body, and social environment, promoting a stable and functional life. The medical specialty in the field is called psychiatry. These professionals evaluate not only the biological aspect of the brain, but also the psychological, social, and emotional factors that influence human behavior. Psychiatry views the individual and well-being, where mind and body are deeply connected. Among the most common disorders, treatment with psychiatry and depression, anxiety, bipolar disorder, schizophrenia, addiction, personality disorder, and emotional crisis. Treatment may include medication, psychotherapy, family counseling, and psychosocial rehabilitation programs. In addition, psychiatry plays a key role in mental health promotion and suicide prevention, helping people develop coping skills, improving self-esteem, and strengthening interpersonal relations. In summary, psychiatry is both a medical and human discipline that seeking to understand and relieve mental suffering, restore emotion, well-being, and promote overall balance. Thank you.
Hello, my name is Orlando Roman. I am going to talk to you about diabetes. It is a chronic condition in which blood glucose remains elevated because there is a lack of insulin, the body does not use it properly, or both. The most common types are type 1, where the pancreas produces little to no insulin, usually begins in young people, and requires insulin from the time of diagnosis. Type 2, which involves insulin resistance and insufficient production, is closely linked to being overweight and a sedentary lifestyle, and gestational diabetes, which appears during pregnancy and increases the future risk of developing type 2. It truly matters because if it is not properly controlled, it significantly increases the serious risk of a heart attack, a debilitating stroke, severe kidney failure, irreversible retinal damage, painful neuropathy, and chronic foot ulcers. However, with proper and timely detection and effective management strategies, that significant risk can be substantially and effectively reduced. Risk factors for this condition include a strong family history, the presence of excess body weight, a sedentary lifestyle characterized by physical inactivity, a dietary pattern high in ultra-processed foods and sugary drinks, uncontrolled hypertension, dyslipidemia, active smoking, polycystic ovary syndrome, and an advanced age, typically over 35 to 40 years of age. Although it can potentially appear much earlier in an individual's life, it may remain completely silent or present itself with symptoms such as excessive thirst and frequent urination, blurred vision, persistent fatigue, increased hunger, unexplained and persistent weight loss, recurrent respiratory infections, and a noticeably slow healing process. Diagnosis is established with fasting glucose of 126 milligrams per deciliter. Glucose levels 2 hours after a tolerance test, 200 milligrams per deciliter or random glucose.
Hi, my name is Jamilka Jimenez and I'm going to talk about the cancer. The fundamental nature of cancer, which is not a single disease, but a constellation of diseases characterized by one core principle: the breakdown of the normal regulatory mechanisms that control cell divisions and survival. In healthy tissues, cellular proliferation, differentiation, and programmed cell death, or autopsies are strictly balanced. Cancer initiates when this homeostasis is disrupted. Benign tumors, which are localized, often slow-growing, and do not invade surrounding tissues. While not cancerous, they can cause serious complications due to most effect. Malignant tumors, which constitute cancer, their defining feature is their capacity for local invasions and ultimate metastasis. Cancers are categorized based on their histological origin, which inform their behavior and treatment. The major classification includes carcinomas deriving from epithelial cells, which constitute the majority of adult cancers, sarcomas arising from connective tissues like bone, muscle, or fat, leukemia, and lymphomas originating in the hematopoietic system, with leukemia primarily affecting the bone marrow and blood, and lymphomas arising in the lymph nodes. Central nervous system cancers, which develop in the tissues of the brain and spinal cord. Cancer is fundamentally a genetic disease of dysregulated cellular homeostasis characterized by uncontrolled proliferation, local invasion, and the potential for metastatic dissemination. Understanding this biological framework is the cornerstone of modern oncology, driving diagnostics, prognostication, and the development of targeted therapies. Thank you.